So you've seen the news reports from around the country, the respiratory virus affecting thousands of children, causing many to be hospitalized. How serious is the outbreak and who is likely to be affected? Dr. Scot Ackerman is one of the First Coast leading oncologists. He joins us every Friday to talk about important issues like this one. Dr. Ackerman,
thanks,
always
Nick.
Good to see you.
Good to see you,
This
Nick.
is a little scary, especially me having little ones. This is something that's kind of going on. We really need to know what's going on. But first of all, what exactly is this virus?
So there's a severe virus that's spreading throughout the United States right now, mainly in the Midwest. It causes a respiratory illness, and it's called Enterovirus D, as in David, D68. So this is a strain of enterovirus. And enterovirus is polio is a type of enterovirus. This is not polio. This is what we call a non-polio enterovirus, and it presents itself similar to the flu. But the difference from the flu is that it affects breathing much more severely than the flu. 21 states has seen cases, none yet in Florida. The first cases were just identified in California recently. I think the graphic we have is a little dated still, because California just identified some cases, and Georgia also just identified some cases. In addition to that, there's some cases seen in Canada as well. So you can see in the graphic there that most of the cases were in the Midwest. This is the fall right now, and we're hoping that with the cold come winter time, that the winter freeze will help die it down. This virus will die down as the winter approaches. But right now it's spreading through a number of states.
Wow. What are some of the symptoms that we should be looking at in our kids? I know you mentioned the flu, so flu-like symptoms, but what are some of the others?
So this is like the flu. As I said before, the difference is it causes much more severe problems with breathing. So you have symptoms like the flu, like fever, runny nose, cough, muscle aches, body aches, trouble breathing. Another difference is the fever with this is a lot lower. When you get the flu, you get a high fever. With this, the kids that have this typically don't have that high of a fever. So that's why it's a little bit challenging. But they have much more severe trouble breathing. So if you notice any of these symptoms, in your kids especially, it's important to see your doctor and positively identify this as the Enterovirus D68, so you can monitor symptoms and treat the patients appropriately.
Should we be asking the doctor then specifically, can you make sure that this is not in there, or would they just be testing for flu or other types of things?
They could do testing. When you're at the doctor, they'll do testing.
But we ask specifically, right?
Well,
for that.
when you take your child to the doctor with these flu-like symptoms, he or she can get samples of sputum and those sort of things and test for this virus and to see if you truly have this virus.
Okay.
And the thing, because either way you want to provide the same care, whether it's just the flu or D68, the treatment is the same.
Okay.
But with D68, you want to be on the lookout for more severe symptoms and make sure that you're on top of the respiratory symptoms a lot more diligently.
Now, how serious is this, and who are the people most at risk?
Well, this is one of the most severe instances we have seen of this virus. This virus what was around about 40 years ago. We saw it as well. It wasn't as severe as this or as widespread as this. And so it's been around, but it just never is that severe. So this is one of the most severe instances we've seen of this virus. The people that are highest risk are young children and children who have underlying respiratory problems like asthma. They're at high risk. They're not at any higher risk for acquiring it. They're just at higher risk because they already have some compromise of their pulmonary function.
On top of it.
So the asthma on top of this makes it more severe.
Is there anything preventative that we can do? How can we protect the kids and protect ourselves? I don't even know is this something that adults can get as well?
Yes, by the way, adults can get it too. We're more concerned with children though, because children seem to, for whatever reason, their system is such that they seem to be affected by this more severely than adults. But adults can get it as well, especially those adults that have any kind of immunocompromise. They're susceptible to it as well. So we get the flu virus, right? We all get the flu virus shot, not the flu virus, the flu vaccine. Right. I got mine last week, I think, last Tuesday, for the fall, and I encourage everyone to get the flu vaccine. But that won't cover this.
Doesn't help.
That covers the strains of flu that we see out there today. This is not the flu. This is Enterovirus D68. There's no vaccine for this virus. So the best way is to do proper things that we'd recommend to minimize infection for anything. So good hygiene, hand washing. Make sure you wash your hands with soap and warm water for at least 20 seconds. Disinfect the surfaces. Be careful of surfaces that were touched by other people. Okay. Doorknobs, countertops, remote controls in hotels and those sort of things. If you're around people that are sick, stay away from people that are sick. Make sure, especially if you're around someone who's sick, that you're extra diligent in washing your hands.
Same thing with anybody that has the flu or has any of these things. These are precautions we should take all the time.
Anyway, right, same sort of things. But be a little bit more diligent right now because this is a more severe virus than we're used to.
Dr. Ackerman, thank you so much as always, and thanks for the information and for sponsoring this segment. If you have any questions regarding this topic or any other health questions that you might have, visit Dr. Ackerman's Facebook page, facebook.com/Ackerman Cancer Center.